My name is Shelby Allen. I've been a nurse for 8 years now. My specialty is cardiac.
So I'm Tessa. I got into nursing straight out of high school.
My name's Megan. I got into healthcare. My mom is a nurse and my parents have both worked in healthcare since I was small.
So we have a few clips for you on medical shows. So we're gonna get started with the first one here.
What is it? PDA?
No, CPR.
Are you doing that too hard?
Okay, someone call 911.
His CPR skills definitely weren't up to par. But again, he thought that this person went down, which is always the importance of checking for a pulse, which is why I think the public should have a basic knowledge of CPR. So if they're awake, they most likely have a pulse, but that would not indicate that we need CPR. I mean, my first reaction would always be give CPR. There might be people out there that have a DNR, a do not resuscitate. If they do not have that anywhere, like a bracelet or, if there's not somebody with them that says, no, they're a DNR, they don't want to do this. I feel like I have a due diligence to do CPR on them. You are usually protected by like a Good Samaritan law, so that way if something does happen or if you're doing CPR and you don't get them back, like you're not held liable because you were just trying to help. So if that patient did have like a do not resuscitate and you brought them back to life, first of all, congratulations, you did great CPR, but you in no way would be or shouldn't be held liable because, you're just being a good Samaritan. But if they physically say, no, don't do CPR on me, they probably don't need CPR because they're still breathing and they still have a pulse.
Are you doing that too hard?
Oh.
Okay, someone call 911.
And his compressions, he's doing this.
He's doing the Heimlich on his chest. Like that's like a,
yeah, that's not a compression.
Stop, I don't think he's having a heart attack.
But he looks so white and heavy.
Yeah, but he's not heaving for air or making any noise. No air sounds on one side. The CPR must have broken a rib which collapsed his lung. It's a pneumothorax.
Yeah, when we do CPR, we do oftentimes break ribs because you have to be able to push hard enough to get down to the heart to basically essentially artificially beat the heart for them. And in this case, he was a larger man, so it probably took just a little bit more force to do so. It was hard to watch as far as him judging and saying that, oh, you broke his ribs, so it probably punctured a rib, so now he's got a collapsed lung. Well, the only way we can actually confirm that is by x-ray. We need an x-ray to see exactly what is going on. So this potentially could have been dangerous if that is not the situation that he was in, if he didn't have a pneumothorax. And so a pneumothorax is basically a collapsed lung like they were talking about.
Stop, I don't think he's having a heart attack.
But he looks so white and heavy.
Yeah, but he's not heaving for air or making any noise.
And heavy. What does heavy have to do? I don't understand that. He's breathing.
No air sounds on one side. The CPR must have broken a rib which collapsed his lung. It's a pneumothorax.
So what made him go down initially? What made him go down initially? Was it a choking incident? He didn't just have he just said it's a pneumo from compressions.
Well, he wasn't doing compressions right enough to get a pneumo. I will tell you that. So this is confusing all around.
Yes.
But let's just say his lung collapsed.
Yeah.
And that's why he went down. Okay. And then you have no way to tell where, in what part of the lung, is it the whole lung? Is it a partial pneumo?
Is that where you would even put the needle?
No.
Hey, I don't know.
That's why when he did that, I said, it's here, it's in the rib. But that's not long enough to do anything. That's a half, 3/4 of an inch needle.
Look at it, it's
You're not even getting through his fat tissue.
No.
On a man that big?
No.
You're not even getting through his fat tissue.
Would a needle that size work on like a small guy like me, or
No.
does it itself be bigger?
It needs to be bigger.
Okay.
And he's over his heart. You're closer to the heart than you are the lung.
Let's see, that's his nipples here. We're not. Here.
But you still wouldn't get to the heart because your sternum is right here.
You're trying to fix a pneumo up here, I think.
Your sternum, though. You're in the sternum. There's a bone. It's this thick.
Yeah.
You can't get that needle through there. That needle's not tough enough. That thing's gonna bend.
No rush of air.
He's still not breathing. Maybe I was
It's
right.
on his sternum.
No. The needle isn't long enough to reach his pleural cavity.
And I'm glad you figured that out.
this might be.
Huh,
Is
that's
that-
a pen from my golf club.
Could you grab me that martini glass?
This one's almost so bad that there's like, you like can't even comment on it because it's so bad. He didn't even check for a pulse, did he?
We didn't check anything.
We're just stabbing.
We're just putting things places and hope that they work.
They were. Like we didn't have any, nothing.
Good.
And then what are we giving? Like lidocaine?
I thought it was the martini that he was injecting. I was like, wait a second.
I'm gonna say it's lidocaine to numb the area, but
drew it
honestly,
up?
if
Where'd
he's
it come
unconscious, who cares?
Yeah.
Hopefully the painful stimuli wakes him up.
Yeah.
Good.
And if he's down with a pneumo, you're taking too long because he would be in a high level of distress.
And he would also be blue.
blue.
He would be so blue.
He would be like more than panting.
And he's not
like a-
gasping enough. Yeah, it's not.
Yeah,
He's just like,
Good. Okay.
I still feel like
Thank
he's
you.
too high.
yeah, he's in the armpit.
And that's not even sharp enough to puncture, what's it called? Like that thick muscle membrane that's right there. I don't know if you've ever had like the steak with a piece of gristle that you can't like cut through. That's what it's like. So that dull, that dull end of the pen is not puncturing through that.
He put a scalpel through it.
Oh, did he?
He just happened to have, I hope it's not an X-Acto knife, but it looks like that.
Oh, maybe. Okay, let's see. Let's see what it is.
Good. Good. Okay. Thank you.
Yeah, none of that was sterile. He most likely is going to end up with some kind of infection if that were to happen. I know he rinsed it off with vodka, but and vodka is basically rubbing alcohol. The skin wasn't clean, and none of that was going on.
It's a scalpel. I don't know. It looks like it. I don't know. That's his
Oh,
scalpel.
that's an
X-Acto knife that he's using as a scalpel.
It's very clean.
Okay. Thank you.
This man is going to be set. Okay, so he cut him open. He cleaned his pen. His stainless
He's
steel
checking
pen.
the boxes. He's just getting,
Yeah, that's not going through there like that.
no.
There's no way.
So what does septic mean?
He's going to have a massive infection.
And none of that was clean. That martini, not.
She had already drank out
There
of
were
it,
olives
and
in
it's
it.
mixed with other stuff. So it's not like straight 100 proof alcohol.
Some Sprite,
There's
sugar going in
spit,
there.
lipstick.
Ew.
Who knows? It's like vermouth and
Why
gin.
didn't he ask for like vodka, whiskey, bourbon?
You're sitting right by the bar. I
Yeah,
know.
like someone give me
100
some
proof,
vodka.
sealed bottle, dump it on there.
No, we want the martini for the looks. He's
Rush of air. Okay, the lung is re-expanded. Sir, we're gonna get you to the hospital, but you'll be okay.
The other thing that kind of cracked me up was that, as soon as you get, gush of air, the lungs reinflated. Again, you have to confirm that by x-ray. That is not something that usually is instantaneously. They are put on a chest tube to continue to help drawing that air out, because when a lung collapses, you have a big pressure of air that doesn't allow that lung to reinflate. So that's why they're talking about how the rib punctured that pleural cavity. So then you have that pressure going in there, and so it collapsed that lung. And so it takes time for, you put a chest tube in and it helps draw out that air and that pressure, so that way that lung can reinflate. I certainly have never been in a situation where that happened instantaneously. The patient might have relief pretty instantaneously as far as being able to maybe breathe a little bit better. But yeah, it's definitely going to take probably a little bit more time than that to reinflate. And again, don't ever do this in public. Just call 911, no matter who you are.
What would you say to someone who's interested in healthcare?
I would say make sure you you have a passion for people. You have to have a certain level of caring for the people to want to treat them, to want to learn, and to want to do better.
What would you say to someone who's interested in healthcare?
So I was actually thinking about this on my way to work today, that I am the one out of my peers that loves my job. By getting this degree, by having my nursing degree, I get to wake up every day and be a part of somebody else's life and impact them in such a cool way.
And I think that there's so many different aspects of healthcare. So even if a 12-hour shift on the floor taking care of 7 or 8 patients isn't your jam, there's always something for somebody.
Look at us now, we're teaching.
We're teaching. There are nursing positions where you can work from home. You can work in a Fortune 500 company as an occupational health nurse, or you can get down and dirty in the ER.
But like working in healthcare, you really get to make a difference.
Thanks for watching. A big thank you to Shelby, Tessa, and Megan for joining us today and sharing their expertise. Nurses make a big difference in our lives, and nursing is in high demand right now. Being a nurse, you can make about $60,000 starting out, and it can definitely go up from there. And if you want to learn more about nursing, check out your local technical college. If you enjoyed this video, make sure to like and comment. YouTube Analytics says only 1% of you are subscribed right now, so make sure to hit that button, and we'll see you next time.